Okay. Hello, my name is Bob Beach-Slate, and the following talk is going to be about cervical lymphadenopathy. We're going to talk a little bit about the structure and function of lymph and lymph nodes. We're going to discuss the causes of cervical lymphadenopathy, and then we'll finally go on to discuss any investigations or management that might want to be done. So, just to start with, cervical lymphadenopathy is defined as a swelling in the cervical lymph nodes which are found in the neck region. And this swelling can be either localized to just the cervical lymph nodes, or it can be part of a more generalized inflammation. It's important to remember that cervical lymphadenopathy is a symptom rather than a diagnosis. Okay, so the function of lymph nodes. Lymph nodes are basically organs of the lymphatic system, and they have an important role in ensuring the proper function of the immune system. Lymph is the fluid that flows throughout the lymphatic system, and it enters the lymph nodes via afferent vessels. It moves through the lymph nodes, through sinuses, and finally exits via the efferent vessels. Lymph is formed from interstitial fluid, which is basically the fluid that bathes all of the cells in the body, and interstitial fluid becomes lymphatic fluid when it accumulates within lymphatic capillaries. Lymph is obviously filtered within the node, and it's filtered by resident phagocytic cells, for example macrophages, which remove any cell debris or bacteria. In addition to this, we also have specialized antigen-presenting cells, for example dendritic cells, which pick up antigens, they process these antigens, and then finally present the antigens to lymphocytes that are therefore stimulated to produce antibodies. The lymph nodes become inflamed when there's an increase in the number of immune system cells, and that produces this characteristic symptom of lymphadenopathy. Okay, so just a bit about the anatomy of the cervical lymph nodes. We've just got a quick diagram there about the names of all the different ones. But basically there are a number of ways that you can classify the anatomy. One way that we can do this is by dividing them up into superficial and deep cervical lymph nodes, and this is based upon their relationship to the deep cervical fascia. So the superficial lymph nodes are found outside of this fascia and run alongside the external jugular vein, and the deep cervical lymph nodes are found within the carotid sheath and run alongside the internal jugular vein. This classification can be further subdivided into the anterior and posterior chains that run in a vertical plane, and it's basically the sternocleidomastoid muscle marks the border between these two. Some clinicians also divide up the lymph nodes into regional and terminal lymph nodes. The regional lymph nodes will drain a specific anatomical region of the neck, and then a number of regional lymph nodes will drain into a terminal lymph node. Clinicians identify lymphadenopathy just using a physical examination, which is something that we all covered a few weeks ago. Okay, so just to make clear, there are many causes of cervical lymphadenopathy, and this slide is mainly focusing upon the infectious causes. We identified the three main ones as glandular fever, which is viral, and it's caused by the Epstein-Barr virus. Upper respiratory tract infections can be either viral or bacterial, and in children is generally caused by staphylococcal or streptococcal infections. And cat scratch disease, as the name suggests, is caused by being bitten or scratched by a cat, and in this case the causative agent is the bacteria Bartonella henselae. And these three all cause very localized lymphadenopathy, so it's primarily in the cervical region. On examination, the lymph nodes will feel very swollen, they'll feel tender, and they'll also feel very soft. And these three main features are quite indicative of an infectious cause. I'll just hand over to Alice now, who will continue the rest of the presentation.
So another very important cause that we looked at was neoplasm, as with anything. It's different on examination, so when you'll be feeling it, it's not going to be tender, it's going to feel hard, and is often described in books as craggy. So all that means is it's kind of non-uniform, so it's going to feel lumpy. The neoplastic causes can be split into two. So primary is where the cancer is actually coming from the lymph node itself. So lymphoma is cancer of the lymphocytes, which then are accumulating within the node to cause the swelling, and can be split into Hodgkin's and non-Hodgkin's. There's then leukemia, which is cancer of the bone marrow itself, that then causes elevated white blood cells that then aggregate within the node to then cause the swelling. And that can be split into chronic lymphocytic, which is in more elderly patients, or acute lymphoblastic, which is more younger children. Secondary neoplastic causes is the cancer somewhere else, and that area then drains into the node. So we learn in MOD the seed and soil hypothesis. The primary neoplasm is seeding, and then it's sort of soiling and lodging within the lymph node. And areas particularly to do with the cervical lymph nodes would be nasopharyngeal, oropharyngeal, laryngeal and thyroid cancers that would go into the ones that we were talking about in the anterior and posterior chains. So there are other causes, they're pretty rare. There's some autoimmune ones like rheumatoid arthritis, SLE, ones that we don't really know what causes, like the cause of them, like sarcoidosis, and interestingly some drug interactions like phenytoin, which is an anti-epileptic drug. So what would you do if a patient came in? You would look for signs of infection, so you would do a full blood count, looking for signs of elevated CRP. Again, signs of infection, you would look for blood cultures and viral titers, look for general organ dysfunctions at LFTs and UNEs, and erythrocyte sedimentation rate is a generalised marker of inflammation. So depending upon those, you would do further tests. Generally with children, the cause is going to be viral, so you wouldn't do many of these, but a chest x-ray, you're looking for signs of upper respiratory tract infection. ACE enzyme test would be elevated in sarcoidosis because the granuloma actually secretes it. You would do a fine needle aspiration and cytology on that to determine whether it's actually malignancy or infection. You would do a biopsy to stage and grade the tumour, and obviously you need to do a CT, MRI or ultrasound to actually find where the neoplasm is. So how do you manage somebody? So we said children you generally treat conservatively. So you're generally self-limiting, so it will go down by itself. If it's viral, you just leave it alone, as with anything. If it's bacterial, like Bob says, it tends to be strep or staphylococcal, so you would treat with flucloxacillin. If it's malignancy, there are 3 surgical interventions you can do. So you can do open lymph node excision biopsy, which is excision of the lymph node that's actually swollen, or you can do a block dissection of the neck, which is taking out that group, or you can do radical neck dissection, which is radical, so you're taking out quite a lot. And if it's autoimmune, so rheumatoid arthritis or like sarcoidosis, like we said, you would give immunosuppressants or steroids like prednisolone. Thank you very much. Has anybody got any questions?